Go for bigger stuff. Down the anterior surface of the spinal cord. What's that groove called? Anterior groove. Middle. Anterior, median, fissure. Running down the back side of the cord, posterior, median, sulcus. Both are grooves, both about the same depth. For whatever reason, the one in front is fissure, the one in back is sulcus. And then you'll see the cord starts out pretty narrow, then it widens right about here, and that is called cervical enlargement. Narrows again as you go through the thoracic region because all the nerves coming off just serve the trunk. Whereas the nerves coming off the cervical region serve part of the trunk up here, but also the upper limbs. So you have a lot more neurons in there. Then you hit the lumbar region, it widens again. That's called lumbar enlargement. And you have extra neurons in there to serve not just the pelvic region, but also lower limbs. And then sacral region at the end, which tapers into this little triangular tip, conus medullaris. And then the fibrous connective tissue that comes straight down to the coccyx. It's covered in pia. Anchors the bottom of the cord to the coccyx. Phylum terminale. Yeah. And then all of the nerve roots and nerves that are around the phylum terminale. Translates to horsetail, all of this. Cauda equina. What's cauda? Tail. Equina? Horse. There you go. And then you have plexuses, cervical plexus, brachial plexus. And the brachial plexus is actually primarily cervical spinal cord regions. So you can take C1 through C8, and roughly the top half forms the cervical plexus. Roughly the bottom half forms the brachial plexus. So why do they call it brachial if it's coming off the cervical region? Because there is no brachial region to the cord, just cervical, thoracic, lumbar, sacral. Brachial because, for the most part, where do all these nerves go? Arm. Yeah, upper limbs. And then down here, lumbar plexus, and then sacral plexus. And then coming off the lumbar plexus, you have the femoral nerve. You can see it here and here. And then coming off the sacral plexus, the sciatic nerve right here. I don't show any more of it than that. But it would come out from behind the bone here, down the posterior side of the thigh. Femoral takes care of the anterior side of the thigh. So then to apply that to function, which nerve would innervate muscles of the anterior thigh and receive sensory input from the anterior thigh? Femoral. And posterior thigh? Sciatic. The only other thing you could find on here are some of these cranial nerves. And again, they have these labeled as cranial nerve 1. It's really not. What is this structure here? Which is really, really big on the sheep brain? Olfactory bulbs. And then here, these nerves, optic nerves. And then when they come together, what do they form? Optic chiasm or chiasma. And that's where half of the information crosses to the other side. Half stays on the same side. So half contralateral, half ipsilateral. The next one right here, coming out just above the pons, from the midbrain region. Goes to the eyes, innervates 4 of the 6 extrinsic eye muscles. Oculomotor. And then 4, that is trochlear. And which muscle does it innervate? The muscle that uses the trochlea. Superior oblique. And then 5 is on the sides of the pons, and it's pretty big. Trigeminal. 6. Abducens, and what does it innervate? Lateral rectus. And then 7. Now we're getting over on the sides of the pons. Facial. And then right next to it, 8. Vestibulocochlear. Right, so we've got 1, 2, 3, 4, 5, 6, 7, 8. Pretty much going in order. And then 9 and 10 are back up here.
Would you use a
I got to
different
move this
muscle?
over. This is 12.
I mean, would you use a different model for that?
No, they're all good.
Okay.
So here's 9 and 10. And 9 is glossopharyngeal, 10, vagus, and then we go down a little further for accessory, which they show on this side. So all of this is accessory. It's very broad. And then remember, you're going down in sequence, but then 12 you have to come back up, and it's right in front of the olives of the medulla. So the olive's a good landmark. In front of it is 12. Behind it is 9 and 10. So it goes 9, 10, 11, then back up to 12. They're showing you sympathetic chain ganglia here, which will cover autonomic nervous system, so that won't be on the exam. That's later. I guess that's about it.